Hey everybody, you've got Blake Head with Isalis Healthcare here. It looks like we've got several people still kind of trickling into the meeting, so we're going to hang out for just a couple more minutes. We'll probably get started in about 12:02, 12:03. Give everybody a chance to log in and get comfortable. So thanks for joining, and we'll get started momentarily. All right, everybody, we are going to go ahead and get started today. So thank you everyone for taking a few minutes out of your day today to learn about this exciting new integration between Isalis and Dr. First. Just to give you a little lay of the land before we get started, just so you guys are aware, everyone will be on mute throughout the duration of the call, but we encourage and welcome questions. So there is a little question box or a chat box that's hanging there on your GoToMeeting panel. So throughout the webinar, if a question pops up, please do not hesitate to ask that. We'll address all of those at the end of the call. As we get started here, just so you're aware, what we'll be doing is Paul Migatuk will be walking us through the RxInform integration. He'll kind of be talking about the features and benefits and what your patients will be able to experience from that program. And then at the end, I'm going to walk you through a demonstration on the Isalis side. So how does this impact your providers, your clinic? What do you have to do? The good news is that part's extremely easy, so we'll be brief, but we will walk through both sides of this. To give you guys at the highest level, Isalis is extremely excited about this partnership. We know that you guys think all day, every day about how to best care for your patients, and a big part of that equation is making sure that they're getting the right medications at the right time. But we're all keenly aware that if the patients don't take the medications that you prescribe, they're probably not really following that treatment plan that you've laid out, and they're not going to see the benefits that they need from visiting your staff. So the RxInform integration is really designed to help solve that prescription abandonment and adherence problem. So you're going to see how with just by within Isalis by selecting a simple choice from a drop-down list, making sure that you pick the right phone number for a patient to deliver prescription information to, all the benefits that is going to garner for your patient population. So without further ado, Paul, if you don't mind walking us through what the integration would look like for the respective patients, and then we'll turn it over to me for the demonstration on the Isalis side.
Very good. Thank you, Blake, and welcome everybody. Excited to take some time today and walk through what we call RxInform, as Blake was just describing. This is really the doctor-first response to really completing the three-legged stool of prescription delivery. And what I mean by that is, obviously, you as the prescriber, you're the one that makes that clinical decision to start the process, and then the prescription information is then sent or forwarded to the pharmacy so they can actually put the pills in the bottle. And Dr. First and Isalis, and really the whole industry, has done a really good job of getting what you need to write that prescription, getting the pharmacy what they need, all the information to fill that prescription. But one of the inadvertent left outs or casualties along the way was the patient. And if you think about how prescriptions were delivered in years past, the patient would leave your office with that piece of paper off the script pad. That was a tangible reminder that they needed to do something, that there was actually prescription or prescriptions that they needed to get filled and start taking. Well, with electronic prescribing, the patient unfortunately was left out of the loop, and that led to a problem of abandoned prescriptions and medication non-adherence. And when we talk about that, obviously it's a critical issue, because if patients aren't taking the medication, they're not going to get the expected outcome that they and you as the prescriber were striving to achieve. So when we talk about adherence, there are lots of costs to it, right? So there's financial costs, there's human costs, there's healthcare costs. And as you can see over time, that's going to continue to get more significant and more significant unless we get that patient to start taking the prescription, and they can't get to the second fill if they don't take the first fill. So that's where Dr. First began to focus, and understanding that in reality, abandoned prescriptions, meaning prescriptions you write but then are never actually picked up by your patient at the pharmacy, is a problem. So we began to look at it and realized, according to our own internal analysis, about 25% of the prescriptions that are written across the country are actually not picked up by the patient. So we wanted to understand why that is. How come the patient leaves your office with an understanding and maybe even a commitment to fill that prescription and start those therapies? And so we started looking into that and found there's really three main buckets. The first one has to do with clinical concerns. Those are things that maybe they feel asymptomatic. Maybe you just disclose to them that they have a cholesterol issue, but they feel fine, so they're not sure they need to take that medication. Perhaps it's a financial concern. Maybe they don't know what their copays or deductible are, or maybe they do and they know it's going to be an expensive medication because that's the insurance they have, but there's some financial concern that stops them from going to the pharmacy. The third bucket is what I would call kind of lifestyle issues, and that's where they come to your practice in the morning with the intent of filling that prescription later in that afternoon, but as the day wears on, they've got kids in soccer practice, or they need to stop at the grocery store, and so the trip to the pharmacy oftentimes gets pushed till later or till tomorrow, and then tomorrow comes and has issues of its own, and because they don't have that piece of paper, that tangible reminder, that they sometimes actually forget to go fill that prescription. So Dr. First, with that understanding, set out to try to solve that. And the way we did that, and we've been doing this now for several years, the way we did that was to try to pull that patient back in. We wanted to give them, in a sense, a digital copy of the old script pad, but we kind of turbocharge it. And I'll show you what that looks like in just a minute. But what we found is this is all about connecting with the patient, engaging them at the right time. So when do patients care about their health care the most? when they're in a healthcare event. So shortly after you sign and send that prescription, we'll reach out to the patient. Typically, it's about 8 to 10 minutes after you write it. We initiate a text out to that patient. That text, we've also discovered, needs to have something that the patient needs to do. For some folks, that's all they need, as you can see on the screen here. Prescriber has written some prescriptions, send them to the pharmacy, click here for details. This is all they need. Yes, my doctor did write me some prescriptions, I need to go fill it. But if you give patients something to do, even as simple as clicking on the link, they're much more inclined psychologically to follow through and fill that medication. So in addition to engaging the patients at the right time, we give them something to do. And then the third point I'll make here is this is very personalized. This is not a one size fits all. This is going to be something that is designed for this patient with these medications going to that selected pharmacy. And as you can see, like I said, it starts with the prescription, and it's simple, straightforward, contains a link. That link takes them to a secure HIPAA-compliant website. So this gets them out of texting world and now puts them into a web services environment. And here, this is kind of the digital version of the script pad. So it's got the pharmacy name. It has one-click call and directions to the pharmacy. It's got the drug name and information. But then this is where we turbocharge it. Remember I said before we had those clinical concerns. So we put some buttons in here that would allow them to learn more about the medication, why it's important to take the medication. And I'll show you an example of what that looks like in a minute. But I want to stress that this is not marketing information. This is information that's designed to encourage the patient to start the therapies that you prescribe for them. Another button we put on here is a financial or a savings opportunity. If we are aware of a coupon, a cash card, a patient assistance program, anything that we can do to help the patient save money, we want to make that available to the patient. So to be clear, we don't require them to use it. All we are doing is informing them that you have a chance to save money. And if you recall, we had 3 barriers: the clinical, the financial, and the lifestyle or behavioral. If it's a financial barrier, then these coupons, these savings opportunities can be very motivating for the patient to go take care of filling that prescription. And then we also know, as I said, with the lifestyle or behavioral issues, that sometimes patients need that little extra reminder. So what we do is actually allow them to schedule a reminder for themselves on when they'd like to fill that prescription. And I'll show you how they do that. And then we will actually send them another text that effectively says, hey, Mr. Jones, Mrs. Jones, it's time to go fill your prescription. This is when you wanted to be reminded. And we'll put a calendar event on their phone as well. So here's an example of what each of these looks like. The screen on the left is information. This is the clinical motivator to help the patient, again, understand what the drug is, what it's for, why it's important to take it. It could be in the form of a static content where they can just scroll through and read, as you see here. It could be in a short 45 to 60-second video that encourages them to fill the medication. The middle screen is one of the savings opportunities. And in this example, this happens to be a copay card or a patient assistance program. And although it's a little hard to see on the screen, that card has the information that the pharmacy needs for the patient to take care of that prescription. So if you're familiar with the Rx bin and PCN and group number, all of that information is there, because again, we want it to be as easy and seamless as possible for the patient to take advantage of whatever savings that we find and they choose to use. That screenshot on the right is the schedule a reminder. So we'll let them pick, do you want to be reminded today or tomorrow? We let them select a time, and again, this results in a text back to that patient, and they can also put it on their calendar on their phone or their mobile device as a calendared event as well. One note on that scheduling reminder, we've got some intelligence and some helps built into this. We happen to know the pharmacy hours based on the information we have, so we don't let them schedule a pickup time when the pharmacy's closed. We also know it's going to take that pharmacy, on average, an hour, hour and a half to put the pills in the bottle once they receive that prescription. So if they're in your office at 10 o'clock, we don't give them a chance to schedule a reminder until there's about a 90-minute to 2-hour time block. So the first time in this example they could schedule the reminder would be 2 hours later at 12 o'clock. So that's the simple, easy to use, intuitive, addressing those three main barriers: the clinical, the financial, and the behavioral for the patient. So we've done this now for a while. We've got well over 100 million different patient encounters. We are able to successfully message about 80% of the patients. I do want to highlight a couple of things here. One of them is fairly obvious. If we don't have a mobile phone, then we can't reach out, because remember, this starts with a text message. We've got an ability to analyze whatever number is sent to us along with that prescription information to determine, is this a landline or is this a mobile device? If it's a mobile device, then we continue the process and we'll reach out with that SMS or that text message. The other point I want to mention here is that currently this is something that we do for adults. We don't do this with minors. So 18 and over would receive a text message. If you have a minor in your office and write prescriptions, we don't initiate the text. We will at some point, but currently there's a lot of complex requirements and regulations about how and when you can use a minor's cell phone to reach out and deliver healthcare messages. So we're able to effectively reach about 80% of the patients. Of those, we get about 60%, and this number continues to climb, actually engaging with us, clicking on that message. Remember, the text message has the link that takes them to that HIPAA-compliant site. The other thing I'll mention here is we have well over 99% of the patients staying in. You may have seen on the initial screenshot that in addition to the simple message of the prescriber has written a prescription, click here for a link, we also had a line in there that said, reply stop to opt out, which gives the patient, if they don't want to receive text messages, to end the program. We effectively put them on a do not call list, and we won't text that patient a second time if they come to your office again and you write prescriptions. It says 99%. It's actually about a 0.2 of 1% that opt out. So most patients actually appreciate getting the follow-up, and we're actually doing this on your behalf. So when the patient comes in, because you might be thinking, okay, well, that allows them to opt out, but how did they opt in? And the reality is, if you are their healthcare provider and they give you contact information, they are giving you the opportunity to follow up with them about that healthcare event, and effectively, you're authorizing Isalis and Dr. First to help you or to perform that follow-up activity on your behalf. And that's where we have the legal and regulatory right and ability to initiate the outreach to the patient. So it's great that we've been successful with getting patients to engage, but it's even better because patients really do like this feature. So we've been doing this a lot, and consistently we're in the mid upper 90% satisfaction. Now, not everybody rates us, but those that do, if you recall on the landing page of that HIPAA compliant site, you may have seen a thumbs up, thumbs down rating. We let the patient give us a rating, and then we'll put up a dialog box so they can actually send in comments. And effectively, patients do really, really appreciate the fact that you are following up with them, you're giving them educational material, you're helping them save money, and you're helping remind them to follow through and fill that medication. And it's great that we've got a tool that does this, that pulls the patient back in, that turbocharged digital version of the old script pad. But we also had an objective when we set out. We wanted to try to change patient behavior, to drive more patients to the pharmacy to fill their medication. And the good news is it's working. So the blue bar on the left of each of these age bands represents the population that was filling their medication. So with the younger folks on the left, the 18 to 29-year-old, they had about a 27% abandon rate, or 73% filling their prescription. Before we did the text message that had the link to the secure site, the green bar for each age band represents those patients we did reach out to, and either they got the text or they got the text and then engaged with us, and they may have watched the video, read the content, used the patient assistance program, what have you. And as you can see, each age group has its own fill or abandon rate, but consistently across the board, we have successfully driven more patients in the right direction to fill their medications. So we wanted to look at it a little bit deeper and understand a little bit more about what's happening. So this is a line over time that shows what happens with the patients. And when we launched this program or turned this functionality on, and this represents about 1.5 million prescriptions across 180 different medications, on average, we see about a 5 to 10% lift, meaning these are patients that yesterday didn't go to the pharmacy that today do go to the pharmacy. In some cases, we've seen as much as 20% more people actually filling the medication. The biggest difference, what takes them from 5 to 10% up to 20%, is their engagement with us. So if they click on the link and they watch the video and they schedule the reminder and they take advantage of the savings opportunities, the more they engage, the more likely they are to fill that medication. And so that 20%, those are the people that really did take advantage of the information we provide them. So it's a great program to pull the patients back in, help them overcome the barriers that they have, and drives their behavior in the right direction where they're actually starting the therapies that you prescribe for them. So at this point, I will turn it back to Blake, who will walk through the Isalis integration and what that looks like in your e-prescribing world.
Thanks, Paul. That was really super powerful. So what we'll do here is, let me make myself the presenter. Go ahead and share my screen. All right, so what everybody should be seeing today or on the screen here is the prescription pad within Isalis. So the great news about this, right, is not only are there just a huge number of benefits to the patients once they get this text message, but for your own providers, the process of getting that text message into the hands of the patient is extremely painless. So what's going to happen once this integration gets turned on is when you open up the prescription pad, which I've got here today, and you go through your normal course of prescribing. So if I wanted to prescribe, Lipitor 40 milligrams, and then let's just fill out this prescription pad. So literally nothing different here as it relates to prescribing this drug, and save this off. The only new thing that you're going to see is this option to send prescription information. You've probably been seeing this particular option on your prescription pad for a while now, but it's been disabled. We'll be turning this on for everybody across the board early next week is the current plan. So all you have to do is click this drop down and select the number that you want to send it to. Paul mentioned earlier that, in order for this to work, this is sending a text message to the patient. So this list is actually pre-validating that the phone number is SMS enabled. So we're looking at every phone number that's on file for the patient, the home number, the work number, their other number, those 3 numbers that you already store in this patient's profile. Every time you add a number, you change a number, or you open this medication chart tab, we're validating to make sure that those numbers are SMS enabled. And if they are, that's what you see in this list. So if you don't have a number in this list, it's probably not, text enabled. If it is, it's been enabled. So all we have to do is select that and then continue on through the prescribing process. So if I chose to send this prescription electronically, again, this is part of the normal workflow, put my PIN number in, that is all I have to do. That is, firing off that prescription. And like Paul mentioned, as the patient is walking out the door, there is likely going to be a text message hitting their phone. So right when they're thinking about prescriptions and you just had the conversation with them, that's when the information is most relevant and will be presented to that patient. All right. So I actually just got a text message on my phone, and all I'm doing here is just validating the date of birth that was passed up. So the date of birth that we have on file for this patient is shared with Dr. First so that they can securely log into that site. And once they're logged in, all of the information that you just saw Paul walk through is made available to the individual. So actually getting this into the hands, very, very simple. There is one other thing that I think is worth mentioning. You know, there may be, under some circumstances, patients that don't want to participate in this program. Like Paul mentioned, there's a way to opt out of that text message right from there. However, if you want to specifically take a patient out of the program, you can control that from your side as well. So whenever you open up the patient setup screen within Isalis, there's going to be this miscellaneous tab down here in the lower left. Within that section, there's prescription education. So if you ever have a patient that doesn't want this and you want to make sure that they don't get the message, you can turn this off for that patient. And in doing so, that's what disables this box down here and prevents that. Okay. There's also, you know, in some circumstances, maybe a particular provider says, I never want to do this for my patients. We do have ways to opt out of that as well. And there's some documentation in our knowledge base that, you know, should you want to do that, it'll walk you through on the steps on how that works. But big picture, we've tried to make this as simple to use as possible because, you know, again, hopefully you've seen it through Paul's presentation. The benefits are so huge. You know, adding that 10, 11, all the way up to 20% fill rates is huge. It really moves the needle for a given patient and really for your patient population as a whole. So with that, we'll go ahead and pause here and start taking any questions that you may have. As a reminder, you have a question box there on the right-hand side of your screen in the GoToMeeting panel, so feel free to ask those.
And Blake, one thing I didn't mention that I probably should have going through the presentation, you'll notice again, the clinical, the financial, and the lifestyle or behavioral, we allow a pickup reminder to encourage the patient to actually go to the pharmacy and fill that. We also know that some of the prescriptions that are written are going to a specialty pharmacy or a mail order pharmacy, and it's not about the patient going to the drive-through or walking into that local pharmacy. So we actually change that button, and instead of schedule a pickup reminder, we make that a contact the pharmacy button. So if they need to engage and provide a credit card number or an updated address, they just click on that button and it allows them to contact the pharmacy directly. Because again, at mail order or specialty, they don't need to go there. They need to get the pharmacy the information they need so it can be sent directly to them.
Thanks, Paul. It does look like we've got a question here. What happens if a patient does not click on the link that gets sent out?
So if the patient doesn't click the link, and remember, for some percent of your patient population, all they needed was, hey, I just got it. Yep, the doctor wrote the prescription. I'm going to go fill that. I know now I need to do that. But if they don't click on it, we wait about 24 hours and we send one more text, this same text that says, hey, prescriber wrote prescription, click here for information, reply stop to opt out. And if they don't click on the second message, we take the hint. We understand that that patient probably is not interested in getting ongoing texts. We don't put them on a do not call list at that point, but we won't reach out to them again for those prescriptions that were just written.
Thanks, Paul. That makes a lot of sense. We've got another question here. Is there any additional costs for the service? And I think I can take that one. The answer is no. There's absolutely no cost to you, to the patient, to anybody to have this service available.
Yeah, what I would add to that, Blake, is from Dr. First perspective, and I think I mentioned it in some of the introductory comments I made, the patient kind of got left out of e-prescribing. So from our view, this is kind of like core functionality that probably should have been there from the beginning. So because it's part of the core e-prescribing, Dr. First doesn't charge for this. This is a core piece of e-prescribing.
Thanks, Paul. There's another question here is, can you again review the patient opt-out steps? And just as a reminder, there's basically two opportunities where, really three opportunities where, the opt-out could occur. I'll talk about the Isalis side, and then I'll turn it over to Paul on the Dr. First. So on the Isalis side, there's really, there's two ways that I think you could opt out. One is, prescription by prescription, actually, as you can determine if you select a phone number in that drop down or not. So if you don't pick a phone number on that prescription pad, then that patient won't get a reminder for that particular medication. So just kind of be aware of that. If you want sort of a more holistic stop, you never want this patient to get something and you want to prevent it at the Isalis level, as a practice, you can go into the patient setup screen. There's a miscellaneous tab inside of that screen, and then there's a text consent that you can turn off for, it's called prescription education is the generic name in Isalis, to turn that on or off at a patient level. So that's how you can control it on the Isalis side. Paul, if you wouldn't mind addressing the patient side if they want to take the action.
Sure. So if the patient does receive the text, they didn't tell you as the prescriber they didn't want to receive a text, or you didn't determine it wasn't necessary, we will then send that patient a text message. But in the core message itself on their phone, it tells them all they need to do is reply stop, at which point we will put them on a do not call list. And so if that patient comes back to your office 3 months later and you write more prescriptions, and they have opted out, meaning they replied stop to the text message, we won't send them a text for that second visit that was 3 months later. We put them on a do not call list, and that's where they stay until they change their mind or let you know that they want to receive the text, or reach out to us and say, hey, put me back in. I want to take advantage of the education savings, etc.
Perfect. All right. Are there any other questions from anybody on the call that we can help answer today? As you can see, this is a very, very straightforward process. A lot of complicated technical things happening on the back end, and Dr. First is doing a whole lot to, make this information available to the patient, but we're doing it in a frictionless way, both for the person writing the prescription and the person receiving the text message, your patients in this case. So we're really excited. Hope everyone gets the opportunity to take advantage of this. As a reminder, we're going to be turning this on across the board early next week or very late this week. So you should start to see this prescription box, go from blue to that prescription box, this drop down, go from a kind of blue disabled look to a white list of phone numbers that are going to be acceptable here. Okay, another question did just come in. Paul, this will be directed towards you. Does the education part of the text message provide side effect information, or how to take it with or without food?
So the answer to that is it might. So we don't actually deliver specific information based on the SIG or the directions for that medication. We look at the specific drug or the class of medication, and then we will send corresponding educational information. Some of that information, whether it's static or a short video, may address, if there are common side effects, that there could be something in that material that lets the patient know if, in the case of Lipitor, if they're experiencing muscle fatigue or muscle weakness, that's a standard side effect, and they should contact their prescriber. So we have it in some of the information, but it's not a core required piece in every piece of education that we use.
Very, very great questions, around the horn here. Anything else? Right. If not, we can go ahead and wrap it up there, give you, 25 minutes of your day back. We will be sending out a recording of this at I think it'll come out roughly tomorrow around this time. So give us 24 hours and we'll send this out. Feel free to send it around internally. And we'll also post this on our knowledge base should you ever want to come take a look at this video again. All right. Thank you again so much for your time. You have a great rest of the day.